Hi everyone, welcome to AAA's Medicare webinar. We're going to give everyone a minute or two to log in, make sure their audio works. As people come in, you'll hear us continue to welcome them in and keep talking so that they can get their audio set up too. So welcome. On a lovely day like today, we'll give them a minute or two to make sure they get in on time. We'll give them till 2:03 and then we'll start our presentation. That should give everyone enough time. Thank you for your patience and we'll start shortly. Welcome to the webinar, everyone. We're giving everyone a chance to set in, get their audio up. We're going to start right at 2:03. Welcome and thank you for your patience. Just another minute here if anyone needs to top off their drinks, grab a snack. I understand that. All right, all, thank you for your patience. We're going to get started on this lovely day. My name is Sarah Wallace. I'm there on the left for you. With me today is Karen Anderson.
Hello, everyone. How are you? Thanks for joining us on this gorgeous day.
And this is our Solving the Medicare Puzzle. So AAA realized that our community has this really daunting challenge ahead of them when it comes to medical insurance after the age of 65. They brought Karen and I on staff to help you guys identify exactly what steps you'll need to take for Medicare and when. Common Medicare potholes that we're going to help you identify and hopefully avoid. We're going to go over our enrollment periods today, Part B penalties, what a physician network is, prescription drug formularies, and the difference between the Medicare Advantage and the Medicare supplement plans. So those are a lot of potholes on this road, right? And Medicare lasts for a long time. That's where Karen and I can come in and help you identify your specific Medicare journey. Everyone's journey is their own, a husband and wife's, even though they might be on the same plan, like in either the same group health care or a retiree insurance plan, you still have to make sure you're set for your individual Medicare needs.
And Sarah, if I could just interject here for a moment, perhaps it would be helpful to explain to those who are joining us today. As far as AAA and Medicare is concerned, we are brokers in the sense that this isn't a AAA Medicare plan. We're licensed and certified with several of the health insurance carriers with Medicare. And so we have the ability to work for our members. We're not representing AAA Medicare insurance. We're representing our members as AAA members, and we're able to quote from a variety of plans. So because everyone is so individualized with what their goals are and their health care, we're able to choose from among several plans to find the plan that's best for each person.
Yes, great point. So as we go along, you'll have questions, I'm sure. I really want to take this point to show you the questions function of GoToMeeting. You can send any question over to the staff. I just want to caution you, if your question has any personal information, make sure you make it private to the staff. We want to keep your information safe, and we will try to answer all questions today. But if it needs a little bit more attention and more one-on-one, we'll call you before the end of the day. So use that questions function. Again, if there's private information, make sure to send privately. So we're going to start at our enrollment periods, and it's important to understand what enrollment period you are using to avoid penalties. So we'll start at the initial enrollment period. This is where I'd usually look around the room and say, who's turning 65? This is when all the mail comes in, all the calls come in. This is called your initial enrollment period, and it is a 7-month window that starts 3 months before, includes the month of, and is 3 months after your 65th birthday. After your initial enrollment period, there is an annual enrollment period that happens once a year. This is from October 15th to December 7th, and you can add, change, or drop a Medicare Advantage, Part D, or supplement coverage. So the AEP comes around every single year, and everyone has the opportunity to change their plan. Another enrollment period that's not as heavily advertised is the open enrollment period. If you find after a month you are unhappy with the plan that you choose, those individuals with an existing plan can change their coverage. So this open enrollment period is from January 1st to March 31st, and it's available to everyone with an existing plan. There's another group of enrollment periods called the special enrollment periods, and these are triggered by specific events. Certain events trigger this, such as involuntary loss of coverage. Retirement is a special enrollment period. Retirement of the policy holder. If you are on your spouse's plan and the policy holder retires, this triggers a special enrollment period for you. So this is where having me or Karen on your side would absolutely help, making sure you know that you're going to have the right time period to sign up for every part of Medicare at the right time so you avoid lifelong penalties. All right, moving forward, we're going to go over the different pieces of Medicare and how they work together. So we just talked about at which timeline you'd be able to sign up for Medicare. Now we're going to go over the different pieces. So Medicare Part A and B you may have heard of as Original Medicare. Part A is your hospital insurance, and Part B is your medical insurance. This is doctor services, some preventative services, durable medical equipment. Those are all in your medical insurance, Part B. Skipping Part C for a moment, we're going to talk about Part D, which is prescription drug coverage. Now, A and B, when it's time to sign up for them, you're going to sign up at the Social Security office, either online or at the 1-800 number. Part D is a minimum level of prescription drug coverage the government expects individuals over the age of 65 to maintain. So this is usually obtained through a carrier, either through, if you're going to work past your 65th birthday, your group health plan may have prescription drug coverage involved, or if you get a Advantage or supplement plan, we'd make sure you'd have drug coverage there. So Part B is a minimum level of prescription drug coverage that you must maintain after the age of 65. Now, Medicare Part C is also run by private carriers, and we'll go more in depth on this type of plan later. But what I want you to remember here is that Medicare Part C wraps together A, B, and D into what is called a Advantage plan. So if you hear Medicare Part C, that is synonymous with the Advantage plan. So original Medicare, you can see the red, white, and blue card that'll arrive. It's on the right-hand side here. And if you have both Part A, the hospital care, and Part B, it'll be identified on the card for you. I don't know if you can see it. You should be able to. Hospital Part A, then there is 03/01/2016. So that's the date your coverage starts. That'll be important when it goes to sign up for any supplemental insurance you may need. So if you have both of these, again, both of these are going to show up on your red, white, and blue card. So let's talk about a couple of deductibles and coinsurance for 2021. These numbers do change every year. They're released by the government. Part A comes with deductibles and per day cost for inpatient and hospital care. Part B is going to have a monthly premium. This is $148.50 for most for 2021. So your monthly premium for Part B is $148.50, where Part A usually comes to you as an entitlement. If you have paid into the Medicare tax for 10 years or 40 full quarters, you should be fully paid to get Part A as an entitlement, so no monthly premium. Part B also comes with a yearly deductible of $203, after which Medicare will pay 80% of your physician services, diagnostic tests, durable medical equipment, and all of those services covered under Part B. What that leaves you with is a 20% responsibility to pay for the bills left over. So moving forward, let's talk about how we can kind of put a cap on this risk, right? So 20% of one doctor's appointment isn't, the biggest bill, but 20% of one hospitalization is. So you definitely want to be able to cap your risk and understand how your insurance plan will do that. To walk you through, Karen's going to take you through your choices.
Great. Yeah, thanks, Sarah. I can take it from here. So, how do you cover that 20% risk? We're not going to spend a lot of time on this slide here, but let's say you have your Medicare card. So what do you do now? Well, that's the easy part because you only have two choices. You have the Medicare Supplement or Medigap plan, and then you have the Medicare Advantage, which is also known as Part C. And so those are the two choices that you have. Should I go with that Medicare Supplement, the Medigap plan, or is a Medicare Advantage plan better for me? And that's why we're hoping that you'll call us for an appointment so that we can go through everything with you. Next slide, please, Sarah. All right. Let's talk a little bit about your Medicare Supplement plan. You may have heard it described as a Medigap plan. The reason it's called a Medigap plan is that it fills the gaps that original Medicare Parts A and B leave out. And that's the way that you can mitigate that 20% risk. When you're thinking about a Medigap plan or a Medicare Supplement plan, these plans provide the greatest flexibility. And they really do travel with you because as long as the doctor you're seeing or the facility that you're visiting for healthcare accepts Medicare, you can go to any doctor or any facility throughout the United States. So there are no networks with a Medigap plan. So in the event that you have some type of healthcare issue and you want to find the best physicians and the best care that you can find in the United States, you have that available to you with a Medigap or Medicare supplement plan, because there are no networks. And this is what can really help mitigate that 20% risk. With a Medigap plan, they're very comprehensive. So you'll have little, if any, out-of-pocket healthcare related expenses. They're a very comprehensive plan. Your coverage on this type of plan stays the same. So it's like a true insurance policy. And as long as you keep up with your payments on the premiums, you can have this policy for life. Next slide, please. So let's talk about the Medicare Advantage plans. And one thing I forgot that's so important. Let's just go back to the Medigap plan one more time. The one thing we have to consider with the Medigap plan is that it does not include Part D, which is your prescription drug plan. So if you would like to have a Medigap plan, that's fine, but that only helps to cover the Part B 20% risk that you might have for co-insurance, co-op and co-payments that you might have to make. So I want to point that out. So you would have original Medicare A and B, a Medigap plan, and then also a separate prescription drug plan for that. Now let's go on to our Medicare Advantage plans. All right, and here's the big difference between the two. A Medicare Advantage plan is known as Part C. And this is the plan that you can remember. It bundles everything together. You will have Parts A, Parts B, and Part D, your prescription drug plan. They are available all in one plan, and that is known as Part C. So a Medicare Advantage Part C plan. Another big difference with this is that, as opposed to a Medigap plan, these plans do have networks. So you want to be sure that the physician that you're seeing, if you love your physician, you want to be sure that that physician accepts the Medicare plan before you choose it. And as far as your prescriptions are concerned, in both cases, we want to be sure that you're doing your best to give us all the information so we can find the right plan for you. The other nice thing that's a nice advantage with the Medicare Advantage is that these plans have additional bells and whistles to them. They include things such as preventative dental services, hearing, vision, and gym memberships that aren't available in a Medicare in a Medigap plan. So this type of plan is one that you can consider as well, but keep in mind that there are networks. With Medicare Advantage plans, you do have the option of choosing an HMO or a PPO plan that gives you a little bit more leeway as to your networks. So let's go to the next slide, please, Sarah. So again, we would love it if you would call us. Give me or Sarah a call. Tell us what's important to you. You have been loyal AAA members for many years, and we want to do our best to help you navigate what can be a very challenging decision. And between the two of us, we'll be able to find the plan that's best for you. But take a look at the options here on this screen. On the left is the Medicare Supplement Plan, also known as Medigap, and then on the right, the Medicare Advantage Part C. And I'm going to pause here for just a moment and just let you take a look at them. All right, let's go on to the
One
next
thing I'd
slide.
like to, if you don't mind, Karen,
No, go
bring
ahead,
up
please.
that Karen and I spent a lot of time researching your carriers. She said she's very loyal to her a physician. I've been seeing my physician since I was a toddler. I understand that. We understand loyalty here at AAA. And it takes time to make sure that everyone you see, including your specialists, are covered under network. And we take that time to make sure that, your plan fits you. You're going to talk to your friends, your neighbors, your coworkers about different plans and what they're on. And, one thing I want you to make note of is as you have these conversations, they might not be on the same prescription tiers. They might not be looking at the same physicians. So it doesn't mean that plan's not great. It just might not be the right fit for you.
Right. Mm-hmm. Yeah.
Hmm.
Thanks for mentioning that, Sarah. And let's go ahead to prescription drug coverage, Part D. Everyone, this is such an important component of your Medicare health plan. Remember prescription drugs and how important they are. The prescription drugs that you're on can make or break the health plan. And what's important for you to have ready is whenever you make an appointment to talk with me and Sarah, be sure you bring along the list of your physicians and also all the all the medication, prescription medication that you have. We want to know prescription names, the dosages, the frequencies. Have those ready for your appointment because we're going to check for your physicians and all of your medications. So on this screen here, for those of you who might not be too familiar with the tiers, let me just run through them real quick, although it's obvious on the screen here. Your lowest cost medications are, of course, tiers 1 and 2, and those are your preferred generics and your generics. Your preferred brands, tier 3, that's pretty much anything that you would see advertised on television is considered a preferred brand. And then tier 4 is your non-preferred, and 5 are your specialty brands. Now, when I first got started in Medicare during training, I thought to myself, well, if I take a preferred brand that's a tier 3, I'm good. I know it's a tier 3, and I can start looking at plans. Well, I learned something right away in that not every insurance carrier rates their drugs at the same tier. And what I found out was one company may rate a preferred brand a tier 3, but another will rate it a tier 4. And the difference between those two tiers can be hundreds of dollars. It's unbelievable. And that's why we really hope you'll make an appointment, because Sarah and I will go searching through the plans based on the drug information that you give us. Okay.
I
So,
got a great example. Just this morning, I
sure.
was comparing two plans, and there was over $1,000 difference per month this member was
Oh,
going to have to pay.
yeah,
And if we didn't dig in and see why, we wouldn't have caught that. So having that extra set of eyes and being able to identify the best plan formularies, that's where we can really add value.
right, right. All right, let's take another look at a prescription drug cost factor. Have you ever spoken with friends or family and they've been talking about being in the donut hole and they don't like have a smile on their face like it's an actual donut? Because if you're in the donut hole, you're in what is officially called, termed as the coverage gap, the prescription coverage gap, and that's what that refers to. Let's take a look at this. Don't be afraid of it. We'll take you through it, and many of you will not have to worry about this at all. I think we've determined maybe about 30% of our members have gone into the coverage gap. But let's go over the slide real quick. And keep in mind that every January 1st, everything recalibrates. All right. So January 1st, you are in your initial coverage as far as your prescription drugs are concerned. And as you go and have your prescription medication filled, you pay the copays, and the plan you're with, they pay the remaining retail cost of that prescription. All right. So you're only paying the copays, but they're keeping track of the total retail cost of your prescriptions, and you just keep paying your copays until the total drug costs reach $4,130 retail. All right. Once you get to $4,130 retail, that puts you into the coverage gap. It's also known as the donut hole. And once you're in the donut hole, then the copays disappear. And those who are in the donut hole will be responsible for drug costs of 25% for brand name and generic drugs. All right. So retail costs get you into the coverage gap. And the 25% cost, that's what's going to get you out. Once you reach a total out of pocket of $6,550, then you exit the donut hole, the coverage gap, and you go into the final tier, which is called the final section, which is called catastrophic coverage. And that's kind of a misnomer. If anything, it's good to get to that point, because when you get to that level, catastrophic coverage, you only pay $3.70 for generic, $9.20 for brand name medication, or 5%. And that's until the calendar year. And then January 1st, that recalibrates and you start again up in the initial coverage. Okay. So that gives you a little bit of an idea what to expect. We found that for the majority of people, you don't have to be concerned about going into the coverage gap, particularly if you're on a number of generic medications. You're never even going to come close. But for some individuals, depending on what kind of drugs they're taking, that will be something that you definitely want to factor in to your Medicare plan. And that's why we hope you'll make an appointment for me or Sarah, because we can help you through that, and we can tell you up front when to expect going into the coverage gap, if you'll go into it at all. All right? Okay. So the next steps. We hope that you've enjoyed the time that you spent with us today, and that we were able to give you some valuable information that's going to help you. This is, to me, this is such an exciting time, because you're getting ready to go. You've done all the work all your lives, and now you have the opportunity to do those things that are really most important for you. And Sarah and I would be so happy to go along on this journey with you and do whatever we can to help you navigate some of these complicated decisions. So call us for an appointment. You'll see that our contact information is right there. I'm over here in Western New York. Sarah is over in the Syracuse area, and between the two of us, we cover all of our AAA members, and
Oh,
we would
yeah.
love to talk to you.
We cover from Buffalo, Syracuse, water down to Ithaca. We're here for you. We just want to make sure you have the peace of mind to
Right.
make these decisions, because I mean, this health coverage, it covers you, for the rest of your life. So we're here. One thing I want to say is, if you are more interested in more information around retirement and Medicare, we have a separate webinar later this month. Make sure you sign up for that, because retirement in and of itself is a whole conversation, right, Karen?
That's right. That's right. So, but we want you to go forward feeling calmer and more confident about the options that you have available to you with your Medicare health plans. And keep in mind too that just because you choose a plan, you're not married to that plan. You can make changes on an annual basis. Sarah and I can show you how you can make a plan change during a special enrollment period. So if there is an event, a major health event that you're dealing with, don't be concerned as far as your plan is concerned. Sarah and I can help you through. And if we can find another plan that can help you and make a change through a special election period, we're going to do that for you. So we want you to be assured that Sarah and I are here to help you. So make an appointment. We'd love to talk to you.
Thanks for your time, everyone. We'll send a recording out afterwards. We'll let you go enjoy this lovely day.
Thanks so much, everybody. Bye bye.